Institutional paralysis on the federal level is in part responsible for the spread of these diseases. When federal employees are not paid, the maintenance of the health of others becomes of secondary importance to fighting for one's own survival. I witnessed with my own eyes a man named Pascal get hit by a car on the street in North Kivu. Under Congolese law, the driver of the car is responsible to pay for his medical bills, and he broke both of his legs. He was escorted into the general hospital by a policeman and the driver. The policeman found a doctor, and they proceeded to get into a fight about who was going to collect money from the driver as the driver fled the scene and Pascal laid mangled in the hallway. When the doctor came back in, he yelled at Pascal about who is going to pay your medical bills, and Pascal yelled back and said, "I have no money, so please only do the most modest of services." We also see an institutional void on the provincial level. An example can be found in South Kivu, where one office houses this conglomeration of causes: health, social, humanitarian affairs, gender, family, and the child. And worse still, the office is headed up by a man who has no training in health whatsoever. Eastern Congo is also struggling because of an absence of medical staff who have fled their posts and villages, running in fear from rebel armies. There is a large-scale looting of materials from hospitals by rebels and by doctors, which means that the post-delivery room of the village you see here is without even real beds for new mothers. As other researchers have noted, another lethal challenge facing the Congolese is the expedited transmission of HIV and other STIs by soldiers who carry these diseases and knowingly infect their victims. And there is a discord between international NGOs and the reality on the ground. NGOs often have agendas that, while well-intentioned, do not match with local needs. This means that there is more money earmarked for fistula surgery than is needed by the 1% of the population requiring this surgery, while the mental health of survivors of rape is inadequately addressed, and the other 99% of the population is hiding in their houses, suffering from malaria and starvation. Finally, the psychological effects of rape warfare must be treated on the community level. I found a coping mechanism of the Congolese to be making light of rape through laughter and comedy, serving as an indicator of severe trauma. As laughter is brought to such a serious event, we have to ask ourselves how serious the event will be considered by generations to come. With such multi-systemic problems, it is extremely difficult to come up with concrete solutions. By listening to clues provided by realities on the ground, we might be able to slowly unravel the knot that is institutional paralysis. First, if we revisit Pascal's story, we're reminded that it resulted in a lose-lose situation for all involved. All were angry and felt that they deserved justice. These are the sorts of situations that encourage the proliferation of rebel armies in this region. But just for 1 second, imagine how the story could have been different if both the doctor and the driver were paid, and the policeman were paid their salaries. Pascal most likely would have been treated, and both the policeman and the doctor would have gained dignity from doing the work for which they are responsible. And since soldiers in the Congolese National Army state that the cessation of their salaries is part of their justification for raping women, there is reason to believe that if we pay their salaries, the rate at which they rape might slow down. Second, there is a lesson from actors in the health sector who have maintained their legitimacy and respect, in contrast to the state-run hospital that was the setting of Pascal's story. Even if we imagine that the hospitals in Eastern Congo are fully equipped, it would still not be safe to travel. Going outside means traversing roads and forests that are occupied by soldiers and putting oneself in debatably greater harm than staying home and suffering from malaria or typhoid. In my experience traveling in a Heal Africa vehicle, we were able to transport the sick from their homes to hospitals without noteworthy aggravation from rebels. So capitalizing upon the credibility of the health sector and then working to maintain that credibility should be taken seriously. And third, my data suggests that the abandonment of women who were raped could be mitigated by initiatives that increase their status, such as those which give them money and skills. So I'll close this story today by adding that the Congolese culture seems to have a powerful buffering effect against this astronomical suffering that they have become a part of. Every Sunday, they wake up and they sing to their Lord. They dance, they tell me, because it reminds them that they're alive. I hope that in taking you to a place today that you may have never been, and bearing witness to stories of people whom you've never met, that you are provoked to become part of this story to help bring peace to Eastern Congo. Thank you.